Hello, and welcome to Jersey Matters. I'm Larry Mendte. On this week's show, we'll talk with the CEO and president of the New Jersey hospital hardest hit by the coronavirus, where they're working on a promising new treatment. We'll also talk with Congresswoman Mikey Sherrill about possibly more money coming to the state of New Jersey. Can New Jersey file for bankruptcy? It's been suggested. We'll take a close look at that option. The head of the New Jersey Chamber of Commerce comments on the governor's cautious plan to reopen the state. And a New Jersey singing star rolls up her sleeves and gets to work to help out during the coronavirus. And now my interview with Shereef Elnahal, former New Jersey Health Commissioner and now CEO and President of University Hospital in Newark. Dr. Elnahal, thank you so much for spending the time with us today and talking to our viewers about the situation at your hospital. We're all excited about the Convalescent Plasma program that you are undertaking along with Rutgers University. Could you explain what it is, and can you give us an update on how it's working?
Absolutely, Larry. So we're very excited about this. This is a partnership with Rutgers, New Jersey Medical School, some of the most prominent physician scientists in the country investigating this right now. It's also a partnership with the U.S. Food and Drug Administration, the FDA, which is allowing us to give something called convalescent plasma, which is essentially a filtration of blood from people who have recovered from COVID-19, trying to extract their antibodies out of that blood. So when you go and give blood, there's a process by which you actually just get the plasma, which has these antibodies. And what we can do is then reintroduce those antibodies in folks who are in the middle of a fight in COVID-19 in one of our patient units here in this hospital. So we've already delivered over 40 units of this plasma therapy to patients in our hospital. And we're one of the bigger contributors to the national study looking at how effective this can be.
Can you give us any update? Can you tell us if it looks good?
Well, it's too early to tell right now, Larry, if it helps, but I'll tell you we're seeing some promising signs. The folks that we're giving it to in the hospital, many of them have recovered. This, of course, has to be a statistical look, a scientific look over time. But we're hopeful that it will actually prove beneficial and that we will have been one of the first hospitals to do it in America.
Your hospital, the University Hospital, has been hit hard by the coronavirus. What are the numbers right now?
So right now we have about 140 patients in our hospital with a confirmed diagnosis of coronavirus, a couple dozen more who are under investigation. That means they have a pending lab test for coronavirus. This is actually a lot less in terms of numbers than just last week or 2 weeks ago. We really peaked right around that April 10th to April 14th timeframe. At that time, almost every patient in our hospital had coronavirus. We were at over 250 patients in our hospital alone. And these were folks that were in our intensive care unit, our regular care units, our emergency room. We had to find and retrofit new spaces in the hospital just to be able to accept the increasing number of patients, Larry. So we are finally starting to see a decrease in the number of admissions, which is promising, but we have to remain vigilant and make sure that we treat these patients successfully to try to get them out of the hospital.
Is this downturn an aberration? Do you know, or is it really a positive sign? I mean, it's going to be a positive sign either way, but is it a trend?
Thankfully, Larry, it does seem to be a trend. So we now have several days in a row where each day the number of admissions is going down, the number of new patients coming into the hospital. That doesn't mean that if folks aren't responsible with social distancing, that we wouldn't see an uptick of that. In fact, the models still predict that if social distancing were to end, that hospitals across the state would be seeing increasing numbers of patients. So it's really important for me and everybody in the hospital industry, but also public health, to double down on the governor's messaging around staying at home.
Have you had all the equipment you need? Have you had the test? Have you had the ventilators? Have you had the beds?
Well, in terms of personal protective equipment, Larry, and ventilators, thankfully, we've been able to keep up with the demand. Every single patient that has needed a ventilator and our hospital has gotten one. And we have been keeping up with personal protective equipment, but that's not to say that we haven't had challenges. It's a constant moving target every day for us to be able to keep up. And we're still on the phone every day with suppliers trying to get enough personal protective equipment. Some of the measures that the state has taken in terms of getting things from the national stockpile, especially ventilators, and sending them to us have been extremely helpful. But right now, states, hospitals, really everybody trying to acquire these things are competing with each other to be able to keep up. And that's really not how it should be, Larry.
There's so many things that we're learning from this pandemic that will help us in future pandemics. And I want to talk about some of those things because I know your hospital experienced them. Let's start with the use of Army medical personnel. I know that they helped you immensely.
They really did. In fact, they came just at the right time. We were in a situation, Larry, where I'd be walking through the wards trying to support our frontline healthcare workers, and I saw ratios of the number of patients to nurses that I've never seen before in healthcare. And we're not alone in this. Hospitals across the state are facing critical staffing shortages, the combination of increasing numbers of very sick patients with a reduction in staff because more and more staff are getting sick, or they're caring for a loved one at home who may be sick during this global pandemic. So the increasing demand against a reduced supply of healthcare workers was really stressful. And so the Army personnel could not have come at a better time. They came about 10 days ago. They've been incredible since they've been here. They've filled critical staffing gaps, and they've really been able to help us meet the demands that our patients have.
Dr. Elnahal, there is this wonderful story amid all of this tragedy that came out of University Hospital. And it was when you were having a particularly bad weekend and you didn't know where else to turn, and you turned to EMS in Newark and they responded. Could you tell that story?
The personnel in the emergency room never even thought to think about calling the EMS staff because these are folks that are in the field. They are busy themselves, and somebody had the thought to do it because everyone else was out of ideas. We were trying to call staffing agencies. We were doing everything we can. And so that one phone call changed everything. Folks that were not immediately on duty in the field showed up. We even had our helicopter, the North Star, come and bring a nurse to help folks out in the emergency room. They did everything from assist with ventilator management to even housekeeping, things that we needed to do to turn over the rooms to keep them as clean as possible. They helped out with everything, and it was really just a tremendous moment. It was really emotional. The emergency room staff were in tears when our EMS team arrived. So this is just one of so many examples, Larry, of the heroism of our frontline healthcare workers during this crisis.
Talk about the pressure on these healthcare workers working in this environment. Why I know that you had at least one healthcare worker die because of COVID-19. To see that happen, to understand the risk that they're going through, I can't imagine the emotional pressure on them.
Oh, it's tremendous. One thing I'll say, Larry, is that all of the analogies to wartime and battlefields with this aren't just analogies, it's real. The fact that every time you walk into a room, you're concerned about your own safety, your own life, excuse me, as a nurse, is something that I noticed myself when I was on the wards talking to people. And the need for personal protective equipment. Some people are outfitted in uniforms, just like you would see our Army personnel do in the middle of a war. And also the fear that folks have that if they don't go in that room, that patient might be affected. But if they do, they're putting themselves at risk. And so it's really a different mentality that our healthcare workers have had to have. They didn't really sign up for this. They thought they were going into a situation where we would have all the personal protective equipment we needed, that we had ways to address all the infectious disease problems that might come up. So this global pandemic took us all by surprise. And that's why, again, especially in a situation where people are understaffed, that has been a tremendously stressful environment. So in addition to the Army arriving, we've had traveling nurses come from South Jersey and other places that have really helped. And again, this is, even though they're stressed out, they've stepped up to the plate and they're doing their jobs and they're saving lives.
Another thing we've learned, I there was certain demographics that were hit hard by COVID-19, and we knew that the elderly may be hit hard. I guess what was a bit of a surprise was the people of color were hit so hard. As we learn from this pandemic, what has to be done so that doesn't happen the next pandemic?
Well, unfortunately, Larry, having recently been health commissioner and been a public health official, the conditions that a lot of communities of color in New Jersey live in didn't make this very surprising to me. I've been worried about this since the beginning. Newark is no exception. It's a densely populated area. There's a lot of old housing stock. There's a lot of communal and congregate living, especially for elderly and more vulnerable populations. And so the outcomes that we're seeing are a function of that. They're also a function of the baseline higher rates of other diseases that make your course of coronavirus much worse. Diabetes, congestive heart failure, COPD, asthma. These are all much more prevalent in minority communities, and Newark is a majority minority community.
You just mentioned you used to be the health commissioner, and one of the things that was under your watch were the convalescent homes and nursing homes and the retirement homes in the state of New Jersey. What can we do to stop a virus like this from running rampant through these convalescent homes?
So we learned the hard way, Larry, that the stock of nursing homes that we have in New Jersey, in terms of the buildings, how they're laid out, and the number of patients that are fit into those buildings, number of residents, I should say, does not lend itself well to infectious disease outbreaks, let alone a global pandemic where everybody is at risk, especially the elderly. And so you're seeing the results of that now. This is decades, if not a century, of history and the long-term care infrastructure in New Jersey. We have to see major changes in this going forward, unless we expect to see more outcomes that are similar.
Any final thoughts, any more thoughts on what we can do, what we've learned from this pandemic to be better prepared in the future?
Well, one thing I'll say, Larry, is that this is the most humbling experience for infectious disease experts, for public health experts, for folks trying to run hospitals like myself, because we've never seen a virus like this before. A virus that can be so easily transmitted from person to person without any symptoms at all. A virus that has such a wide distribution of effects on people clinically. You can either have no symptoms at all or have one of the worst diseases imaginable in terms of your lungs and your breathing. And so we really have to think fast and learn fast from this. But one thing that's obvious in terms of a lesson is that we have to have a better stockpile of personal protective equipment, of ventilators, of things that as a first world nation, we never thought that we would be short on.
All right, sir, thank you so much. I really, you're always gracious with your time. When you were health commissioner, you're gracious with your time today. I pray for you and your staff. I hope everybody gets through this okay. I hope this downtrend you're going through right now continues and we can get on the other side of this.
Thank you so much, Larry.
That was Shereef Elnahal, CEO and president of University Hospital in Newark. When we come back on Jersey Matters, we'll talk with the New Jersey AARP about how they can protect seniors during this pandemic and get them ready for the next one. That's when we come right back.